is really about the COVID-19. So I will maybe I can do a lot of help for my superintendent, Dr. Guo. So I'm sitting here. Hello everyone. Thank you for you give us opportunity to join this meeting. Thank you.
Thank you, Dr. Chang. We'll just wait a few minutes before everyone arrives and then start at 4 p.m. Manila time. That's okay?
Okay.
Okay.
Hello, Benjamin, and the chief will join.
Patrick?
Patrick will join.
I'm not sure. Cheryl, is Patrick coming? I didn't see if he had RSVP'd.
I believe he will join.
Okay.
All right, thank you.
Okay.
Shall we start so that we can run to time? You can see many colleagues will join later, I'm sure, but perhaps we can start. So Tsai and Wang, did you want to make introductory comments or is it Director Singh? Sorry, you're on mute, Director.
Okay, maybe we can start by the schedule. I will say some more after the seminar.
Okay, Tsai and Wang, were you going to make the introductory comments, please?
Okay. Thank you, Benjamin. And distinguished guests, ladies and gentlemen, good afternoon. I'm Xiang Wang, Chairman of Committee of International Relationship of Chinese Institute of Engineers. I would like to express my appreciation to everyone for your support and the concerted efforts in arranging it knowledge sharing seminar. CIE and the ADB held the first knowledge sharing seminar in 2017. Then it became an annual event. In 2019, CIE and ADB signed a MOU to formalize the seminar among other collaborative activities, including training courses, etc. Due to the COVID-19 last year's, the seminar was canceled. And this year we make it online webinars and have 6 topics under 4 sectors: urban, water, transport, and health. We believe it will be beneficial to facilitate best practice for infrastructure development of other members. Today's webinar is the series of the 6th. It is also the last one for this year's under the knowledge sharing seminar between ADB and the CIE. The case being discussed is regarding the health sectors. It is also a successful project promoted by PPP model. In response to the impact of the epidemic, it is very important to improve the healthcare service. Through the PPP model, high-quality technology management capabilities and innovative development can be introduced. The Kaohsiung Municipal Xiaogang Hospital is the first PPP hospital in Kaohsiung and implements the municipal government's medical and health policies, including the board control, setting up international airport rapid test stations, providing excellent medical service and health care, and showing the importance of the PPP during the epidemic period. I hope the audience will enjoy today's topic. Leave the floor to Benjamin. Thank you.
Thank you, Tsai and Wang, and welcome everybody today to this knowledge sharing seminar between ADB and CIE. Look, it's my privilege to make some opening remarks. I think we've all looked at Taipei China with a bit of envy in the way you've managed to respond to COVID. I think you learned some hard lessons from SARS, but not just learned those lessons, you really managed to apply those lessons to build systems which were resilient to such new threats as a far more infectious novel coronavirus. So, we're really keen to learn from the systems that you've developed, the ways in which you've implemented responses, the ways in which you've engaged with your community and brought them along to adapt and respond for what has been a very rapidly changing environment as we struggle to understand everything we could about how to manage this novel disease. I'm also keen to hear about the public-private partnership model and how this functioned in real time during an emergency. Clearly, the private sector has been critical in developing new tools such as vaccines and diagnostics. Therapeutics less successfully, but we are slowly getting there. But it's the public systems, by and large, that have had to set the policies and enact the practices. So this synergy between public-private partnerships in healthcare delivery, I think, is critical for us to understand how to do that efficiently and effectively as we look to build far more resilient systems that can deliver the best quality healthcare to everyone in our communities across our region. So without further ado, I'd like to introduce Superintendent Chow Hong Kuo to lead off with his presentation today. Thank you very much.
Okay, thanks for your introduction. Good afternoon, ladies and gentlemen. It's my pleasure to make a short presentation about will be slideshow about status in the clinical care and community service to COVID-19 according to Taiwan's experience. So these are our target. Yes, sir. So I'm The superintendent of KMSH Dong Guo. The Kaohsiung Municipal Xiaogang Hospital is located in Kaohsiung, southern Taiwan. Kaohsiung is a beautiful ocean city. So next time when COVID-19 passed away, welcome everybody to visit Taiwan and visit Kaohsiung. So it's my content today. So I make an introduction about the KMU system. So the reason that the university operates PPP including the following reasons. So as I know, most medical university has their duty and responsibility. They often be the parties for researchers. They must cultivate the cross-field talent, and they also have their university social responsibility. The similar aim of KMU is the educated research and service and contribution. So we focus on social impact. So the benefit of PPP model in Taiwan, there are many successful examples. So the KMSH is one of them. So the benefit for the operator should be they have increase in the operator's income. Can provide student various internship, can enhance the research capacity and expanding the opportunity to the USR. So the benefit for the local community would have the good care for the resident and also be balancing the local medical resource and creating job opportunity. For the city government, the PPP model will benefit from the employee selection and training and can have a saving budget and cost and make sure the safety and good care for the citizens. So the KMU University affiliate health care system, including one medical center, 2 regional hospitals, and 2 community hospitals. We have more than 3,000 beds. The outpatient per year is more than 3 million, and the inpatient is more than 70,000. So the numbers of our employees are around 6,000. So the KMU milestone about PPP, we started first contract of PPP since 1998 for Kaohsiung Municipal Xiaogang Hospital. The second contract is Kaohsiung Municipal Datong Hospital. Is in 2009. And in 2014, we got a third contract about Kaohsiung Municipal Teaching Hospital. So the milestone of KMSH in PPP, we got a first OT contract on 1997, and the second OT contract on 2008. So we got a newly contract about OT and BOT on 2018. This contract was for 35 years and can extend to 50 years. This is a long period for KMU can operate and perform the USR. So we suffered from serious from SARS about 70 years ago, and then many lessons. So during this period, we prepare ourselves for the emerging infectious disease. However, the COVID-19 has more violent nature and enduring past, so it causes very damaging and exhausted resource of healthcare system, even in Taiwan, even many countries in the world. So I will make a short introduction about the policy for COVID-19 in Taiwan. We have maintained medical preparation for COVID-19. Once the most important, we set up the infection control manual for the medical facility. So as the infection control guidelines set up, the government set up the unnotified on-site inspection and drill and medical response. So to sure every hospital can obey the infection control guideline. Then the inpatient may be identified, maybe according to the risk. There is one important and special point in Taiwan. We almost 100% of people have under the NHI insurance. So we can trace in the paper the footprint and their travel history, exposure history through the nation health insurance system. So this is very important for Taiwan control the condition of COVID-19. Then we make every hospital to implementing the inpatient isolation and triage according to their risk. And then we contract the referral system and referral recommendation. We set up the conducting a national testing network, and our government monitor the capacity of health care system. We expand the capacity of quarantine place, and we adapting every model to the community testing network and referral and tracking system. So the communication between government and Xiaogang Hospital is this model. This is same in every hospital. We through the decision-making is by the National Health Command Center, so-called NHCC, and then from the advisement from the CDC, and put the policy into the Department of Health in local government. Then the policy is passed through the regional hospital, every hospital. So the duty of municipal hospital, for example, in Xiaogang Hospital, we have had many duties during this period. For example, we in the international port, we be the evacuation hospital. We also set the travel medicine clinical for COVID-19 vaccination, and we also have set up the rapid test station in the airport, and we set up the screening station in community in the Xiaogang and Daliao district health center, public health center. So we also perform a screen test into every company if they need. We also perform the community vaccination. Okay, we also do the responsibility hospital and have the increasing business work. So we divide the main management into border control and community pandemic prevention and medical system preservation. So in border control, the Xiaogang Hospital has set up the working station and communication site in the Kaohsiung International Airport. Beginning, we do this for prevention of dengue fever transmission. And in this time, it work have a large effect on the prevention of COVID-19. So we build a Kaohsiung International Airport evacuation service. We also set a night group for the team between the Xiaogang Hospital and the airport worker. So we can communicate efficiently. If something wrong or suspect case is found, we can transfer to our hospital immediately. Another, we set up many test stations around the airport, including in the beginning, we set up the rapid screening station in the airport. Then we perform the PCR test through nasal pharynx or deep throat saliva to find a possible case. Then in the recent time, we set up the antigen screening test and antibody screening station for the outbound travel. So we can prevent the travel transmission of COVID-19 to the island out of Taiwan. So in this border control, the KMS contribution, including to be a station to take an antigen screening and PCR test for a traveler. And the traveler must wait for a result at the airport. It can reduce the transmission risk from travel. So we also build an evacuation hospital for an international airport. So the suspect case will be immediately sent to KMSH to reduce the burden of community. So this is a contribution in border control. So what about the community pandemic prevention? In KMSH, we do many things in community pandemic prevention. Including we also are responsible for community vaccination, community screening, and enterprise tests. So we also, this is one example. We for the aging patient, we create an innovative community vaccination type. It's modified from Japan Machi injection model. It's very convenient and safe for the aging. So then a scale of vaccination is much improvement for the aging people. And we also sell the cross-domain online communication system. So in the community pandemic prevention, the KMSH contribution including enhancing the communicating activities and improve massive vaccination and infection control in community. So during this period, about 3 to 4 months, we perform an RT-PCR screening about 24,000. We perform the vaccination about more than 55,000. We also perform as community and enterprise screening more than 20,000. This is our effort, and we spend many manpower to achieve this goal. So how about medical system preservation? So the strategy of medical system preservation, the first one important thing is reduce the medical loading. As you know, there are many countries, hospital is burned down, is collapsed during the COVID-19 in other countries because there are not enough time to prepare. However, Taiwan is lucky, so we have the time to reduce our loading. Every hospital must reduce their loading up to 30% of the usual loading. So the hospital can manage more preparation for the quarantine, for screening, for vaccination. The second, the patient divergence and pathway control is also important. We avoid or prohibit the and avoid the risky patient into the hospital. This reduce the transmission of COVID-19. Another, we increase the testing for COVID-19. In Shaogang Hospital, we increase about 20% of our beds of the COVID-19 patient. Okay, we also strengthen self-health monitor level of our employees. We also encourage our staff members to receive vaccination. So we up to now we have 99.8% of our employees receive a second dose of vaccination. It's very high. It's the highest in Kaohsiung City. So I think it also be most high in Taiwan. We also enhance the manpower for screening suspect cases. So during this field, the KMS contribution is to enhance the screening capacity to completing the prevention and system for case follow-up. We preserve the medical capacity. We also use AI technology for epidemic prevention. So, however, there is many challenges for COVID-19 pandemic prevention. There are big problems for the government, but also with some challenges for the hospital. For example, we have the cross-domain information sharing and integration is often confused. There are difficulty for conveying the message to every people. We must improving the accuracy of tests. We also have a high risk of exposure for our healthcare workers. So in other way, we have a potential crisis of environment for my transmission. So how about the MSH to overcome the challenge? So I think it's a PDP model is a benefit. So university also problem solving by innovation. So we got many innovation to overcome the challenge in COVID-19. So the firstly, we set up the cross-domain online healthcare, including with the health worker police station or citizen department and government, because there are many teamwork, non-medical work. They are there of adequate knowledge about COVID-19, and the hospital visitor should be increased to avoid from causing infection. So we set up a cross-domain online healthcare network to cooperate with the Xiaogang District Office, police station, the chief of village to complete the epidemic prevention network, so they can increase the unnecessary visits to hospital instead of face-to-face communication. There are also the amended among the message or information coming to people, because there are many migrant workers in Xiaogang district are increasing recently. There are many and many. Also, they are hard to these people is hard to follow up the latest information from the government due to the language barrier. So our solution, we develop the NIDED app by use cooperative with Wenzhou University. So we develop 4 languages, including English, Latin, Silent, and Indonesian. So they can let many migrant workers to understand the latest information about prevention. Another challenge is about PCR. PCR is the golden standard of confirm the COVID-19 infection. However, it is time consuming. It's also very high cost. You need a P3 lab laboratory. Also, he had a very important disadvantage, sampling error, because the PCR should be performed by through the nasopharynx or discernible. Especially the nasopharynx had a sampling error. Another method is antibody rapid test. However, it also be costly and high false negative rate. So the high cost false negative rate of antibodies rapid test is sure because the observations from the naked eye observation is very not correct. So we cooperate with the technology company to develop one more affordable face and prices system. We develop one small size the computer spectrum device is lower cost and can be handheld. So it is convenient. I can connect to phone, so they can upload to the cloud. Okay, you also user friendly and low injury to avoid swab missing. So this this device is cost many attention by the government because it's very useful in detecting antibody. So we also use this technology to develop another device. We want to bring our Medicare. Since during the COVID-19 period, the Medicare should be more home-based hospital to avoid COVID-19 transmission. So we use the technology of being able to receive many tests at home or a long-term care unit. So we reducing unnecessary hospital visit with preventing residents from cross-infection. So this innovation that my hospital to won the 2020 National Innovation Award by through the COVID-19 antibody test and the home test device. So this device now is exported to Japan's market. This is their demonstration car in Japan. They show the innovation, small size, is very correctly high accuracy, and is very handheld. So it's very convenient for people at home or at any place beside house. We found there are one loading from the X-ray because the COVID-19 need more and more X-ray to confirm the infection. However, the manpower in hospital, especially radiologists, is not enough to diagnose this X-ray. So we cooperate with informatic company to develop one system. This system can gather help from AI. The AI will judgment the X-ray is risky, is high or low. Then we set the priority for a doctor to confirm the X-ray. They let us our hospital to avoid later for the correct diagnosis. So it is having ER doctor to make a correct diagnosis for COVID-19. Next I will play a short film for introduction.
Chest X-rays are a common clinical imaging tool for detection of many diseases including pneumonia. This kind of examination can be performed a million times per year. With this huge amount of images, reading them can be time-consuming. However, in order to take care of patients and save lives, the clinical team still need to make diagnosis in a short time. Our main objective is to help medical doctors to use and train the medical models easily by using their own local clinical data and leveraging their accumulated expertise. With high accuracy, the models can help greatly reduce personal workloads spent by doctors in the interpretation of image. Our AI Edge cloud solution offers flexibility, reliability, low latency, and low cost advantage, which is popular in many vertical applications. The edge-to-cloud framework has been implemented in some hospitals in Taiwan, including the X-ray interpretation model of pneumonia and chest, etc. Through our medical AI inferencing features, hospitals can get AI-assisted images, and by using expert-labeled data, we can optimize the models, then create a continuous and advanced process cycle. HighLabel is an efficient resource utilization of AI-assisted annotation tool along with standard or customized models. With pre-trained models and by retraining models, up to 10 times speed up. Makes no sweat data and annotator management for huge annotation workload. By using well-trained medical AI models, the detection of the possible lung diseases and syndromes can be shown directly on the X-ray. With accuracy over 90%, it can relieve the overload of routine healthcare and improve diagnostic effectiveness. Continuous monitoring system provides tracking and viewing series of images. The system will establish an image set for users to observe the difference in the images, and then track the patient's condition. For some urgent cases, the images will need to be reviewed as soon as possible. The system will automatically send a message to related medical personnel according to the priority level. This will help ensure every patient gets the most appropriate care. With our models deployed into the hospitals to provide AI-assisted diagnosis, it will allow medical personnel to focus on patients' care. Our AI services are actually implemented to actual local hospitals, and the feedbacks are always positive.
Okay, this film is a show we developed a new X-ray AI system for help our doctor to overcome the overloading from the challenge of COVID-19. In this period, the X-ray is very, very high burden for doctor to operate. This system will help us for many. Now we are developing another technology for increasing the transmission and contamination to help for a healthcare worker. We developed a non-touch heart rate and respiratory rate and oxygen saturation system. They can application field in preliminary screening in emergency room and respiratory infection disease screening in automatic care in the designated ward and remote monitor care. So this system is almost complete. We will soon put into our routine service. So now is my conclusion. So the advantage of the PPP scheme in the addressing COVID-19, for example, the chemists can gather help from Kaohsiung City government for the financial support because every manpower for the vaccination or screening is gathered thoroughly from the Kaohsiung City government. Another, they can gather allocation and support human resource from the government because the non-medical manpower is supported by the city government during this COVID-19. So it shows the government system to have a message during this period. In another way, we also got help from the FAMU system because the FAMU system has many hospitals. We can help each other, and then if as show if we need research or innovation, can by through the FAMU cooperative system to get immediate help, so we can develop some AI system, some device soon after the COVID-19 infection. So, in another word, the key message we feedback more than 40 millions per year NT dollars, and also rebate the 10% our surplus. Our surplus about the 10% for the equipment and carrier culture. So this is a benefit for each other. So more efficacy response to challenge, the government can give us intervention from the vaccination and foster the vaccination rate within the medical personnel. And the government and the university will help us in innovation development. So I think the advantage in the PPC scheme is very, very huge. But we are facing a COVID-19 challenge. It's my brief presentation. Thanks for listening.
Thank you very much, Superintendent Kuo. Can we now turn to Kuei Chen Lin, who's going to be our discussant for this afternoon and facilitate some discussion. I think she's got some questions to start with, but I'd also invite you to put your hands up and write in the chat if you've got any direct questions of Superintendent Kuo. Thanks very much.
Thank you, Benjamin. And also, first, thank you to Dr. Kuo for sharing Taiwan's wonderful experience. Actually, I know the Dr. Kuo from this project, this Kaohsiung Municipal Zhaogang Hospital by the PPP. So, my first question is about the Dr. Kuo having. You have mentioned you also to cooperate with the government to fight against the pandemic. The government asked all the hospital need to reduce the regular service at least 30%. So, has the government provide some subsidy? This is because from your presentation, you have stated the government need to have some financial support during this time, but I can understand what's the financial support. Can you explain detail? Thank you.
Thank you for your question. I think because the government should access our hospital to reduce the our capacity to care patients. So the government recommend that hospital must reduce the loading, but in return, it will subsidize 80% of the expense for health insurance in the second quarter. As for screening, to enhance the rate of screening, subsidies are given for hospital to purchase machines such as high throughput automation PCR test equipment. Such as in our hospital, they give us a 5 million NT dollars to buy this equipment. So for the many respect, they ask us to do something, but they will give us compensate and give us money to let us do such things. So it is a balance. Maybe we will reduce our loading, but in another side, it will compensate some expense for the health insurance.
Audience,
So.
Okay. Benjamin. Hello, Benjamin?
Yes, sure.
Maybe
I don't know any other questions.
Welcome the other audience to open this question.
Yeah, I'll ask a question. If anyone else has got questions, please write them in the chat or put your hand up. Can I just ask the 30% load reduction, so diverting patients, were they provided any care, and was there any way of, how did you go about deciding which patients could not come to hospitals, which patients could be serviced by primary care, which patients had to wait at home with no care? Thanks.
Okay, thanks for a good question. So we often hold a health examination, and we postpone the elective operation. And also, actually, the number of emergency rooms is also naturally decreased about 20 to 30%. So the patient we select to postpone is also not emergent. However, the cancer or the patient need a chemotherapy or need an emergent operation or have an acute infection, acute illness, this patient also be also can admit to our hospital. So the usually medical loading is about 30 reduced in this period.
Can I ask a follow-up question? You mentioned one of the revolutions was improvements in home-based care. I'm just wondering, are those improvements for some conditions to treat in the home, are they likely to stay? Will they be a permanent change? And if so, how does that affect the revenue of the hospital or the way in which you provide that service?
So you, sorry, Benjamin, your problem is about, can you, I beg your pardon? So, because of lack of the system.
Yeah, you mentioned one of the innovations was improvements in home-based care. Okay, so non-hospital-based care. I'm just wondering, are those improvements there to stay? Will you manage many conditions now at home that you would normally have managed inside the hospital?
Yes, but because a lot of patients maybe use our telephone system to see the doctors, because we have another chance to see the patient, such as if the patient was stable and he can use our internet system and use the telephone to contact with these patients. The doctor can use the telephone to contact with the patients. The patient, if his condition was okay, and he will ask his family to take his insurance card to our hospital to take medications. But not always every patient can use this system. Such as this patient had fever and he had emergency condition, the telephone or telecom visit or telecom medicine cannot be used in this condition. So I think maybe we can use some conditions and we can use this telephone communication to reduce these patients to go to our hospital, but not always many patients.
Okay, so I make a comment we developed one new machine for the patient to decrease the medical visit during this time. Because in the usual time, many patients go to hospital just want to follow their sugar, their liver function, or their renal function. However, this examination can be checked by our new machine. So our new machine can perform this test in home or in long-term care unit. So I so-called frequent Medicare is so-called reduce the unnecessary visit during COVID-19. So they can receive an examination in the home, in a long-term care unit. So they, in the usual time, they must go to hospital and see the doctor and receive a blood sample collection. However, this increase the formal transmission during this period. So we innovate this machine to change the style of Medicare. Okay. Can you hear?
Sure, if there's no further questions, I'll keep asking questions. Can I ask, you talked about the importance of the relationship between government, Kaohsiung Hospital and the university, and the importance, we always see the importance of medical research units, clinical research units attached to hospital, and the benefit that is creates in driving change and improving quality. I'm just wondering, as a mechanism, you know, how did you create a system where you could talk to government and tell them about your ways of doing things, innovative new ways? How could you get the university's new developments brought into government policy and practice, so that these new innovations could quickly be implemented during the emergency?
Because our system is a Kaohsiung Medical University health care systems. It includes the university, and our hospital is a municipal hospital. But I think there are different aims, different goals. Such as in our hospital, we focus on service. But in our Kaohsiung Medical University hospital, it is focused on research is the major, and the teaching is the major. So different hospitals have different goals, and the government, his focus is focused on citizen, his people in Kaohsiung City. So many institutions have many goals. So if you want to convince Kaohsiung City government, we must focus their view, because they are focused in Kaohsiung City citizens. So if we can provide many good equipment and many good service to our government, and then they can be persuaded. But for our Kaohsiung University systems and our Kaohsiung Medical University Hospital, it is focused on the research first and the teaching first. So we can cooperate with our Kaohsiung Medical University Hospital and focus on our research, such as we can provide many blood samples and do a good collaboration, and we can use this municipal hospitals location, and they are a different kind of disease, and it is a good teaching material for our Kaohsiung Medical University. So we can provide our characteristic to different institutions and make good collaborations.
So I make a comment. So in the PPP scheme, the municipal Xiaogang Hospital, it also be a member of municipal hospital, not a private hospital. So we have the same or a similar responsibility as other municipal hospitals. So the government duty often asks our hospital to achieve it. So when facing the duty, we often use the university innovation system and research capacity to solving the problem. So our solving method will compare with the usual municipal hospital. So often our solving method is better than usual municipal hospital. So the government will give the opportunity to our university to cooperate with our university to create more and more cooperation. For example, I would let Chief Zhang to explain the dengue fever control. In the recent, we got a duty to solving the dengue fever.
Because we know in dengue fever in Kaohsiung City, we collect a sample and we find the dengue fever was imported from Southeast Asia countries. Because we take this sample and send to our Kaohsiung Medical University hospitals and the Kaohsiung Medical University, we find the strain was come from Southeast Asia country. So and we talk to our Kaohsiung City government. If you want to cut off the dengue transmission, you have to put many manpower into our Kaohsiung International Airport, and if we got a patient, he had a fever, and then he maybe can be perform a rapid test. If the rapid test was positive, this patient have to isolate it to our hospital. So, and we persuade this strategy to our Kaohsiung City government, and they call us and call the Kaohsiung International Airport, and we cooperated. So we set a working station in Kaohsiung International Airport, and about 3 or 4 years ago, we used this strategy. And initially, Kaohsiung cities, they are about in 2014, there are about 20,000 cases dengue fever in 1 year, and in the 2015, almost about also 40,000 cases in Kaohsiung City. But we used this strategy. This indigenous dengue fever case was dramatic decrease. So we used the Kaohsiung University's study method and used our Kaohsiung Municipal Xiaogang Hospital manpower and combined with the Kaohsiung City government. So use this method, we can dramatically decrease the dengue cases in Kaohsiung City in recent 3 years.
Thank you for that. We've got 2 questions now. Can I ask Director Singh, followed by Chief Osewe? Thank you.
Thank you, Benjamin. This is very excellent presentation. I have a quick questions. Because the Kaohsiung Municipal Xiaogang Hospital is a public hospital. In terms of PPP model, is there any difference between the public hospital and the private hospital? What is the benefit of this model for the public hospital? Thank you.
So thanks for your question. So in the PPP scheme, the Kaohsiung City government will save many budget and cost for the manpower to operate the public hospital. And additionally, we will feedback annually about 40 million NT dollars for the city government. So they got a good quality and good health care and good super income for the Kaohsiung city government. In other way, the PPP scheme, municipal hospital, are often operated by the university, and the university have many innovation. They can use their innovation to create many good solving methods for the government policy, including the dengue fever, including the DM control, including the chronic disease control, and so on. So the different from the pure public hospital is the innovation and in the money feedback. So at least the 2 are different.
Patrick?
Yeah,
Thank you very much.
Very excellent, very good presentation. The question I have is that as ADB, we are always looking for lessons that we can share with other countries. From what you've learned in your situation, what would you say are some of the top lessons that we can share with other countries? Thank you.
Thank you. Okay, so I think in the PPP scheme from Taiwan, I think it's important to select a good partnership because the hospital is operated by a private company. Is not better than the university. So choose the coverage is important. This is the first point. The second point, I think the PPP scheme in Taiwan is successful, even in Xiaogang Hospital and in other cities, because they can bring the city government more income and more systemized training employees, and they can give a good modeling of employee training, so they can share the experience between the different municipal hospitals. So I think this is I can image now. So
I think the Kaohsiung Municipal Shanghai Hospital, because it is a public and the private systems, so it are more flexible, because in these manpowers, we want to use more manpower. It is more flexible because we can increase our manpower. So the salary increase or the manpower increase or the equipment buying, we are more flexible. So it is different from the public hospital.
So it's cost effective. So between the system, the hospital doctor can work each other in. For example, the doctor in Xiaogang Hospital can also support outpatient service in the Kaohsiung University Hospital, in the Datong University. So the manpower is saving and the cost is saving. So I think this is very, very important. For the PPP scheme can get a good or better outcome in this structure.
Thank you.
Thanks so much. I think we're at the end of our time, so I really want to thank you for a wonderful presentation, and I'll hand the floor over to Director Singh for some final comments. So thank you again.
Thank you.
Thank you, Benjamin. And Chief, also in Patrick, do you want to say some words first?
No, it's okay. Benjamin
okay.
is part of my team. Thanks.
Okay, thank you. Thank you, Benjamin, and thank you all to join the webinar. This is the last, but not the least, important online seminar of CIE series of knowledge sharing. We know that the health issues are a more important project promoted by ADB, especially after the outbreak of the pandemic. Taiwan has a good COVID-19 and the epidemic prevention experiences. We are very willing to share our experience with the ADB and DMC, especially the PPP model experiences. I would like to appreciate the CIE's efforts to continue providing Taiwan experiences to share with the ADB. I also would like to thank the chairman of the CIE, Wang Zi'an, for his opening remarks. I would like to take the chance to gratitude to Patrick Owen, Chief of the Health Sector Group, and his team for co-organizing this seminar. And also would like to thank today's speaker, Guo Zhaohong, the Superintendent, Kaohsiung Municipal Xiaogang Hospital, for his brilliant, practical, and helpful, useful sharing. I also would like to thank the discussant, Lin Guizhen, Assistant Vice President of the CI Engineering Consultant Corporation. Finally, I also would like to take the opportunity to thank Benjamin for your excellent hosting and the coordination for the to making this seminar smoothly success. We are happy to cooperate with the ADB to continue to provide experiences sharing and increase our contribution to ADB and the DMC in the future for the Asia and the Pacific countries. I hope we can share the experience soon in the near futures. Thank you all again for your participation and have a good weekend and take care. This is very successful seminar. Thank you for your participation. Thank you.
Thank you.
Thank you to everyone. Thank you.
So if somebody wants to say another words, no? Okay. So Benjamin, so we can conclude